As promised, we're going to focus a lot on ejaculatory disorders. This week, we're going to talk about anejaculation. Seriously? No ejaculation at all? Yes, that is a condition that may be faced by people who are having problems with infertility. There are two possibilities. One actually is anejaculation due to no production of semen, or the second one due to production of semen but backward retraction of the semen itself. Let's deal with anejaculation due to occlusion. So in fact, if you consider the actual semen itself is propelled forward by the productions inside the prostate, and if there's an occlusion of the duct, for example, after chlamydia or gonorrhea infection, then there will not be any productions of the semen into the outside world. Apart from acquired infection, another type of anejaculation is caused by prostatic cyst. When someone is born, there may be a cyst that is formed inside the prostate, and that cyst itself may prevent the productions of the semen, and also for somebody unable to ejaculate. In order to overcome that, small operations such as aspiration of the cyst or operation to unobstruct the semen production tubes may result in recovery of that infertility. Obviously, the more important thing is to do a diagnosis. There is another condition called retrograde ejaculation. In fact, it's difficult to differentiate on clinical ground to find out whether someone has got anejaculation due to obstruction or retrograde ejaculation. But easiest thing to do is to actually analyze the presence of the sperms inside the urine after climax. If somebody who suffers from retrograde ejaculation, they will climax normally, but after climax, the urine is being retrieved and assessed by embryologists. If there are sperms inside, this person suffers from retrograde ejaculation. There are a few reasons why men suffer from retrograde ejaculation. One of them actually is medications. So certain medications such as alpha blockers that is being used for blood pressure, one of the side effects is retrograde ejaculation. As men get older, the shape of the prostate may not be so conducive for propulsion of the sperm, may also result in retrograde ejaculation. But in Malaysia, one of the commonest reasons why people get retrograde ejaculation actually is diabetes. Diabetes can result in neuropathy, and that neuropathy actually diminish the control of propulsions of the sperms and result in retrograde ejaculation. For another ejaculatory disorder, it is a condition called hematospermia. What does it mean? It just means seeing red in your ejaculations. Can someone really ejaculate blood? Is it because you have sex too much, or is it because of cancer, or is it because of infection? If you are curious to find out, then you stay tuned for next week's Putting Dr. G on the Spot.